Hello everybody, my name is Jenny Sprung and I am doing it myself videos. This is going to be treat yourself naturally for pain relief of the sacrum, the SI joint, the low back, the lumbar spine, the mid back, thoracic spine, and upper back, thoracic spine. We have a model here that I will refer to as we move through the sequence. This is the back buddy, which I will review at the end. You probably have one of these maybe somewhere in your house, but it is a great tool to alleviate pain and discomfort in the sacroiliac joint, in the glutes, and in the sacrum and pelvis. We won't review the glutes today too much. We'll have another video for that. You'll need balls. You've got a tennis ball around the house. You've probably got a lacrosse ball. I know you have a dryer ball and a racket ball. Any of these will do. And you have the foam roller. I'd like you to start with the foam roller, and most of you have these. This is a pretty soft roller. It's not too hard, but any will do. So I'd like you to first start, if you would, by placing your body on the foam roller. And the best thing to do is to, make sure that your glutes and your bottom are right at the end here. Okay, so you're not going to have a long tail of the roller out of this end. If you find that your head is not supported by the roller, which is what I want your head supported by the roller. If your head's not supported by the roller, you're going to want to scooch down. Now I want to make sure that I'm in the middle of the picture because I'm doing it all myself. So I'm going to roll off real quick and scoot down just a little bit and then come back up and reposition myself. You can do that anytime. So spread the legs wide, make sure they're wide like a tabletop. Arms are wide, that way you've got 4 support system for you so you don't fall off the roller. We don't want any of that. We don't want the roller shooting out from underneath you. So start to roll on each side. When you roll, you're right on the spine here. And I will have a series for folks who can't get out of a chair, who may be wheelchair bound, or who may actually not be able to get up and move around. Stay tuned for that. I do have a pain relief, treat yourself naturally pain relief series for that. So go to my website, treatyourselfnaturally.com, Jenny Sprung. I'm a neurosomatic massage therapist. I am a myofascial therapist. I do lymph drainage. I'm a certified zero balancer, and I have also been treating patients for many, many years. What I'm reviewing with you are home treatments that have worked for my patients, family, and friends to reduce pain and inflammation, amplify healing from alternative methods, from massage, from chiropractic, from physical therapy. So here you're going to want to roll, and you can move the arm around, taking nice deep breaths, making sure not to arch the back too much. I don't want you arching, and I don't want you tucking too much. Make sure you have a natural movement in that spine. You can roll back and forth again. Take your time with this. Enjoy it. Give your body permission to pause. Feel any sore spots. I don't want you to overdo it. One of the major problems with the foam roller is that people overdo it. They just do way too much of the IT band or way too much of the back, and it creates pain and discomfort. It creates inflammation. We want to create space, reduce fascial pain, reduce trigger point pain, create open, flowing, low back, upper back, mid back, and sacrum. Once you've done this, I'd like you to go ahead and bring yourself up off of the roller, nice and slow and easy. Sit down on the floor. Turn the roller perpendicular to your mat. You can do it on a rug, you can do it on a mat, whatever works best for you. I'm going to go perpendicular. And the first thing we're going to do is our upper back. So our bottom's going to be on the floor. We're we're going to come back and just lean on the roller. Make sure any long hair is pinned up so it doesn't roll underneath the roller. Arms can be here to support the head. Chin is up. Don't tuck too much and don't arch the head too much. We're going to do just a tiny little bit of a bridge. Hold the abs in tight and have some consciousness with your posture. Don't be floppy with your posture. Be in tune and listening to the body, sensing what needs to be done. This is the upper back. You can find a spot, and when you come up near the neck, you're also laying the head there. And it's superb. You can roll the head a little bit, roll a little bit, and then come right down and you're on the blades. You can do a little bit of cross fiber friction, just a little rolling back and forth. And then you can come down to the mid-back. Now here I don't want you to go any further than the rib cage or the waistline. And be very careful of the floating ribs. Just keeping the foam roller perpendicular to the spine and rolling up and down. And see, when I come a little bit further down on the back, do you see how I'm looking over my knees? It's a great position. When you come back up, take breath, and you see I'm going to actually look way up at the ceiling a little bit more. If that's uncomfortable, then just look right straight ahead. A couple more times with this. This is excellent to do any time of the day. It doesn't take very long, and you might even get some great adjustments. You can turn a little bit, go into some of the muscles that attach to the ribs, just a little bit. Slight turn, not too much. You can get underneath the shoulder blades just a little bit. But we'll be doing shoulders also in another video. So now come up off of that, and that's the upper back. Before we move to the low back, I'd like to show you some of these balls with the upper back. We're going to try the dryer ball. It's pretty soft. You can press into it. Tennis ball is also a little bit soft. Lacrosse ball is hard. Racquetball is super soft. Start with a soft ball on a hard surface, or you can use a hard ball on the bed. Just see what works for you. You don't want to go too long, and you don't want to go too hard. You want to make sure that you're being very careful and going mindfully into these body parts. I'm going to start with the racquetball. And I'm going to place it right underneath my back. And I'm going to lift my arm so you can see it. Hopefully you can see the ball. And you'll say, well, where is it? Just find a spot on the back and roll around. And these can be done in the low back. So you can take these below the rib cage and you can start to work these. And for me, the racquetball's not enough. But for some, it will be too much. So you've got to be careful. I'll try the tennis ball and we'll go in the upper back. One of the great things you can do is you can put it right underneath the shoulder blade. I'll scooch down a little bit. It's underneath the shoulder blade. See where it is? Just move the arm around. And these muscles attach up into the neck, all along the upper spine. And see how I scooch down and kind of just roll all over the place with the ball. You can use balls up and down the entire spine. So we're going to take this dryer ball now. We're going to put it in the lumbar spine. We're going to move the other ball out of the way, put it in our basket of balls, and come into the sacrum and the low back. So there's 7 cervical vertebrae. We're not doing the neck today, but stay tuned because I've got a great neck pain relief video. So go to my website, check with my posts. I have accompanying articles that go along with the videos so you can treat yourself naturally, reduce pain, reduce inflammation, perhaps even alleviate it. Pausing, focusing, tuning into your body, sensing what needs to be worked. You are your best healer and you can empower yourself. You can do it. You can do it at home. If you have a great therapist or a great team of healers, then you can amplify their healing by working on things at home. So 7 cervical vertebrae, 12 thoracic vertebrae, 5 lumbar, and 5 sacrum generally. So you can take the ball and you can work in the sacrum too. Might be a little hard to see in the video, but it's going to go right in the sacrum. You're going to put your body on it, and you can just use the legs, use the arms in a T, and roll around. When you find a spot, trigger points can take a long time to release. 8 to 12 seconds, 2 to 3 deep breaths. Exhale, you want to make the exhale longer, always. That's the relaxation. That's where you get the stress release, is on the exhale. A lot of people go, it's really, long exhales. So I'm going to show you the ball on the model so that you can really get a good feel for it. So here is the pelvis. This is your ilium and your sacrum. Let's see, it's probably best to go right here. The balls can go all through here. Some people have tiny sacrums, some people have big sacrums. Choose the ball that works for you. Find one and just roll into it. There's going to be some real sticky points in here. So be gentle. Just start to find out what the body's trying to tell you. Where does it need some release? Where would it like some attention? That's important. Racquetballs are soft. This is a lacrosse ball, very hard. You can go all the way up the entire spine with that. This would be all the way up the entire spine on each side. Don't want to go too far out. Do not go into the ribs. Be smart about it. You go between the shoulder blade and the spine. If you are on the spinous processes, see how it feels. Make your own decision. You can figure out whether that's a good place or not. There are muscles that attach each one of the spinous processes to each other. You can see they're very small, but see what feels good for you. Some people have real bony backs and it's not going to feel good. Other people have more meat to it and it's going to feel better. So I also want to show you the foam roller for the sacrum, and it's superb. And what you're going to do is you're going to bring it again perpendicular. Using good form, abdominals are tight, always nice long posture, open anterior spine. We're always sitting like this, we're always driving like this, we're always flexing that anterior spine, squishing the viscera. I've got a video on viscera. Wait till you see that, it's pretty cool. We're always squeezing through here. So make sure you open up. And what you're going to do is you're going to lift up and bring the roller between the feet and the glute. Come down, lie down on your mat, do a slight bridge, lift up and place the roller on the sacrum. I don't want you to go up in the waist. That's going to be dangerous. That's going to hurt your kidneys. It's going to hurt your vital organs. Come back up and go on the sacrum. And I will show you with the model. So I'm going to push up, bring this out, and show you on the model. Right here, right along in this area. Cross the iliums and down. It's a small space. Some people maybe 5 inches, some people really tiny. Okay? So right here, cross the hip bone in that way. Okay? Make sure you're precise about it because there's some really juicy, yummy points all along this area that will decrease your back pain, that will create space, that will allow you to breathe more fully, that will give your body the break it needs from all of the hard work you do. So here we go, and you can just roll across, going on the sacrum. You can do a little stretch here. Gently relax the head and neck. Hold on to the roller so it doesn't shoot out from underneath you. Bring up the left leg, bring up the right. And only if you're able to do this, start to work in the sacrum. Find a place. Relax the shoulders. Relax the body. once you get used to this, you feel secure, you're not going to hurt yourself, you can start to drop one leg over. And that's where you're going to get some more of the glutes. And we'll talk about glutes in a different video. Right now, I want you to just get the very little bit of glute this way, because the glutes can create a ton of low back pain. And when you drop that leg, you can come back up and let it fall this way, and you'll get a psoas stretch. The trickster, the psoas, attaches on the anterior spine, down into the leg, just at the top of the femur, and it is very much always wanting to stretch. This will also create space in the back. This large muscle can pull that back out of alignment. When you come back up, make sure you really are careful. Bring the leg up slowly, always being very careful not to create too much torsion in the body. This is therapeutic. This is for you to reduce pain and discomfort, not create it. So start off slow, make sure you bring the leg in, and then you can stretch it out. Same arm as the leg goes up. So one arm is always holding onto the roller. And you can stretch out that psoas, iliacus, all the low back muscles. A little more of the glute, and you can come down at the feet, lift up a little bit and go down on the lowest portion of the sacrum, and just do little tiny movements until you find a spot in the SI. Piriformis, you get all of that, but you're going to be very careful, making sure if you stretch the leg out, you bend it carefully and bring it back in. Never both legs out. This is just our video number 1 for low back, sacrum, sacroiliac joint, upper back, and mid back. Okay, I'm going to come off and out. We're going to remove the large roller. You can do this as long as you want, whatever works for you. Don't forget you can do the balls as well, and you can put the balls in the glutes. So here is the sacrum. Right here, there's the coccyx, there's the tailbone. Sacrum, you can go all in through here. But now I'm going to just have you do the very tops of the glutes, because that will really help with low back pain. And the balls can go in there as well. You can lay on your side, rest your head on your arm, and you're just going to hold the ball right there and move the leg and find a spot. And then when you get a little bit better at it, you can balance up on it, but woo! See how I'm breathing in effectively? That means that that's too much. So you're going to come out, find a softer ball, a rack ball, and then go in. Now that's much better. See, now I can lay my leg out, and I can actually affect some of the glute right along the sacrum. And I know some of you are saying, well, where am I going with this? Feel around a little bit. If it doesn't feel right, get out of there. See if you can tune in. And really pause. Be with your body. If your low back is talking to you, answer it. If your mid back is talking to you, answer it. If you're working on the computer like this all the time, you need to open up and put a towel across your upper back and open up a little bit. You know, a physio ball is great for this. You can lay over a physio ball. You can just place a towel there, or simply open up all the way. And create space. So before we close, I would like to show you the back buddy, which is can be really cool. And the back buddy you can do seated, standing, or any way. We do it in the Gulf of Mexico, but more on that later. And you just place the back buddy in a spot and just kind of move it around. Find a spot that's sore and tender. There's a spot that's sore and tender. That's actually right inside the ilium in the glute. Here's the sacrum right here. And then the low back. It has a lot of different places that you can use. And it's up to you to play around with it. We've found that the more that we play around with this, it's really good for some spots. See, there's a great, awesome spot. But if you don't have enough strength, and you don't have enough upper body strength to do this, then just use a wonderful racquetball, nice soft racquetball, and lay on it. So I hope this helps everyone. And please give me your comments and questions. Tune in to treatyourselfnaturally.com. Thanks for being here, and make sure that you check out the other videos, the articles, and my homepage. All right, now I've got to turn the video off. Woohoo!